Hi, it's Maureen O'Hara. I was finishing up with the MRI foot map. This does not need to be signed, but it does need to have the patient's identification on it as well. Here is the um, ortho admission note. 99% of the time we are not the primary, so we don't need to dictate the H&P, but we do need to have some kind of written H&P on the chart. This is user friendly. Be sure to put the date and time. It's 2 pages, so you need to put that on both pages. Put in the pain level, put in the PF number from the outside hospital. I know you know how to do an H&P, so you put in, the age of the patient, whether they're diabetic or not, um, what language they speak. That will help you with when you go to do the consent, where they came from, what the admission diagnosis is, complaint. Before they were admitted, what was their ambulation status? How many stairs or steps do they have to get into their house? This is important for physical therapy and rehab, but also what their ambulation status may dictate a higher level of amputation. If they had an MRI done at LA County, what was the date? Past medical history, the things that we're interested in. Have their hearts been maximized? Have they had any kind of revascularization? Are they on Coumadin, Plavix, aspirin? Do they have a history of seizures that we need to be worried about? Do they smoke? What the living situation is? Dr. Chambers wants to know that. And then please describe both extremities, the good extremity and the affected side. For both sides, please do the pulses, and you can say no lesions if it's the unaffected side. And then if it's the affected side, you can continue on with this in terms of describing the wound, erythema, swelling, discharge, necrosis, maceration. Sometimes you might want to check their lymph nodes. And then don't forget to date and time the second page. Put in what you think, something general. I have here right great toe infection or osteomyelitis. I don't like to label somebody with osteomyelitis until we have proven that with an MRI. And then what procedure you think the patient may need. Then they're going to be admitted to our service. Planned admissions are ones that are in the hospital. We can admit them as an emergency from clinic. We can order these studies. This is just to document what's been done. X-rays, MRIs, EKGs, which will be ordered by medicine, hopefully. Any vascular studies, labs, hopefully have been done by the medicine team. If you've ordered any consults, vascular or dental consults would be the ones that we might order. Physical therapy is deferred. Everybody gets physical therapy after the Tuesday rounds for non-patients, and physical therapy is automatically ordered for surgical patients. Be sure to document the weight-bearing status, what kind of dressing you want, and what kind of pain medication we did for that. Be sure to sign it, put on the patient sticker, and put it in the chart. I'm going to pick up with the daily note in my next segment.